Hello everyone, I'm Professor Lee of Dr. Wild Up TV. Do you have both cardiovascular disease and hyperlipidemia? Then try taking Hawthorn Tea along with prescription drug. There are two regenerative medicinal species, one mountain hawthorn, two American hawthorn. Let me tell you why hawthorn is important for cardiovascular disease. To summarize the clinical studies, there are four main actions. 1. Anti-hyperlipidemia action. 2. Antihypertensive action. 3. Heart protection. 4. Increased coronary blood flow. Let's talking about actual scientific data behind. 1. Reduction rate of total cholesterol and LDL cholesterol 8 to 18%. 2. Antihypertensive action. Systolic and diastolic blood pressure reduction rate is about 10%. 3. Heart protection in heart failure patient. 4. Increased coronary blood flow in angina patient. There are many medicinal methods, but among them I'll introduce the traditional decoction method. Fruit harvest in the fall and remove the seeds and dry in the sun. Big and red fruit are good. Domestic hawthorn is smaller than Chinese hawthorn. Daily dose of dried fruit is 2 to 20 grams, starting from 4 grams in 1 liter of water and decoct it for about 100 minutes, and taking it 2 to 3 times a day as tea. What we are seeing now is domestically produced dried mountain hawthorn. The seeds have not been removed, but I plan to use it as is. Daily dose is 2 to 20 grams, but considering the weight of seed, I plan to start with 10 grams. This is about 10 grams. You have to measure it, right? The amount you see is 10 grams. Add 10 grams of dried hawthorn fruit to 1 liter of water. Press the time adjustment button to set it to 100 minutes. Now 100 minutes have passed. The initial amount of water was 1 liter, but now it is about 500 cc. It looks very fresh. Let's taste it. Wow, good! It has a harmonious combination of very mild sourness, sweetness, and astringency, and it is very delicious flavor. We should know about side effects and precautions. 1. Nausea, diarrhea, abdominal pain. Stop for 2 to 3 days and then start again in small amount. 2. Headache and dizziness. Stop until symptoms disappear, then restart at a lower dose. 3. Allergy symptoms. Stop use and visit the hospital if it gets worse. 4. Dizziness due to low blood pressure. Check blood pressure regularly and adjust the dosage. Precautions. Pregnancy and breastfeeding is better to avoid. 2. Antihypertensive drug, antiplatelet drug, and anticoagulant drug. If you take it, consult your doctor. 3. When taking cardiovascular prescription drugs, it should not be replaced with hawthorn. 4. Check your blood pressure and cholesterol regularly. 5. For long-term use, consult with an expert. I'm going to tell you how to adjust the dosage. 1. Start with 10 grams per day. Continue for 2 weeks. 2. If there are no side effects, continue for 2 more weeks. 3. At 4 weeks, check blood pressure and cholesterol level. 4. If there is improvement, maintain the dose. 5. If not, increase by 2 grams and repeat as same way. 6. When taking long-term use, consult your doctor. Every 3 months of taking it, it's best to take a break of 2 to 4 weeks. Harmonious combination of very mild sourness, sweetness, and astringency, and it is very delicious. Mountain Hawthorn Tea. About how to use and precaution of Mountain Hawthorn, the title was Top 10 Proven to be Effective Against Hyperlipidemia. Part 1 lecture video is uploaded. I sincerely hope this helps you a lot.